Okay, now we're going to shift gears and start talking about the employer mandate. And again, this is one of the provisions in the reform law that gets a lot of attention. The employer mandate states that starting in 2014, an employer that has 50 or more full-time employees would be considered a large employer and would be required to offer affordable health coverage of a minimum value to full-time employees and their dependents or pay a penalty. That is a very loaded statement. And so what we're going to do over the next hour is talk about what different terms in that statement actually mean so you'll know whether or not you're a large employer, meaning does the mandate even apply to you? If the mandate does apply to you, how do you know if your coverage is affordable? How do you know if your coverage provides minimum value? So we'll go through all of that. But again, I want you to keep in mind this general statement that employers with at least 50 full-time employees have to provide health insurance coverage of a minimum value, and that's affordable to full-time employees and their dependents or pay a penalty. So again, the first thing is that we'll want to determine whether or not you are a large employer. To determine whether or not you're a large employer subject to the mandate, you have to look not only at how many full-time employees you have, but you also have to count how many hours are being worked by your part-time employees. So a full-time employee is somebody who performs 30 hours of service or more per week on average. A part-time employee would be somebody then who works less than that. And you have to count how many full-time employees you have and how many part-time hours are being worked by your staff. Divide that figure by 120 and do that for each month, and we'll go through an example in the next slide to determine whether or not you'd be a large employer for the upcoming year. So here's an example, and I didn't go through all 12 months, but I went through the first quarter. So let's assume that this is 2013. You can see we have 3 months that we're going through, January, February, and March. In this example, the employer has 38 full-time employees in January, meaning there are 38 people on staff who work 30 hours a week per or more during that month. The part-time staff accumulated 1,260 hours during January. You divide that figure by 120, and you equal a full-time equivalent figure of 10.5. You would add that to the number of full-timers that you had that month, and you would get to 48.5. Then you move on to February, and you do the same thing for February. There were 37 full-time employees in February. The part-timers accumulated 1,580 hours in February. You divide that by 120, and you reach 13.7 for a total of 50.17 in February. We went through the same calculation in March, and we came to 54.17. Now, you can see that I'm keeping all of the fractions when I'm doing the math. You're required to include your fractions there. But when we get to this very last part of the chart, you'll see that I exclude the fraction and round down. So I'm going to add together my calculation from January, February, and March. It's 152.84 divided by 3 months because we only looked at 3 months. And you can see that the average full-time staff during those 3 months was 50.94. But because you don't have to count fractions, when you come to that very final number, you can round that down to 50. So you can see that if you only look at the first quarter for this employer, they would be subject to the mandate because they have 50 or more full-time employees or full-time equivalent employees. So they would be subject to the mandate. And what you have to do is you have to do this calculation during 2013, during all of 2013. So you would have January, February, March, April, May, and so on. Looking at those figures, how many people are you actually employing to determine whether or not you're a large employer? Because if you're not a large employer, if you're under 50, then you don't have to comply with the mandate. Now, for some of us, my law firm, for example, I know that we have more than 50 full-time employees, so I can skip this step. And for some of you, you may know there's no way I'd ever get to 50, so you can skip this step. But for anyone who's in between, or if you have a workforce that fluctuates a lot during the year, this is a step that you would want to take because you have to know whether or not you're subject to the mandate. You would hate to be penalized because you thought this was something that you didn't have to comply with. So when we're talking about determining employer size, we're talking about adding hours of service. A full-time employee is somebody who averages 30 hours of service or more per week. So we have to know what actually is an hour of service. And this was something that was unanswered for a long time, but new regulations were issued at the end of December that say that an hour of service includes each hour for which an employee was paid or entitled to payment. And it also includes each hour for which an employee was paid or entitled to payment for things like sick leave, vacation time, holiday pay, jury duty. So you're counting not only the hours, the actual hours where somebody is at your office performing services, but you're also counting hours that they're not there because they're on some paid leave. If it's an unpaid leave, that would not be an hour of service. But you want to get this definition clear in your mind before you start counting hours and trying to determine whether or not you're a large employer. So for employees who are hourly, I think it would not be that difficult to count their hours, but for employees who are salaried, it's a little harder. Most of us who have salaried staff don't require those staff members to punch in and punch out. There are 3 different ways that you can determine whether or not, or how many hours of service your salaried staff work. You can actually count hours if you have the records available, so you could count their hours in the same way that you would count hours for hourly employees. You can use what's called a day's worked equivalency, where, let's say, for example, I go to work, I perform 1 hour of service for the employer. I would be given credit for 8 hours. So you assume that whatever's happening during that first hour is going to happen throughout the entire day. You could also use what's called a week's worked equivalency, where if I would be entitled to 1 hour of service for the week, I would be given credit for 40 hours. So I think when you start using the equivalency tests, especially the week's worked equivalency, there's more room for error, because if you're only looking at what somebody is doing during 1 hour during the week, I don't know that you're really going to get an accurate picture of what happened during the entire week. But these are the 3 methods that we've been given if you want to count hours for your salaried staff. Now, this may not be relevant for some of your salaried staff. If you know that your salaried folks are already eligible for coverage, you're not going to change that. Why would it be necessary to count their hours? You're going to cover them anyway in 2014, but this becomes important if you have a salaried employee who's currently not receiving coverage. You'll really want to look at how many hours that person is really working to determine whether or not next year you have to be offering them coverage. Seasonal workers, I'm often asked how a seasonal workforce will impact whether or not an employer is a large employer. With a seasonal workforce, you'll see that the workforce generally increases greatly during a short time during the year, and then it will decrease again. An example could be a tourism-based industry. It could be a golf course. It could be road construction crews, anything of that nature where somebody's workforce suddenly increases and then goes down again, could be considered those people could be considered seasonal workers. So this is what you would do with seasonal workers. If you've done your calculations and determined that you have 50 or more full-time employees, meaning you are a large employer, you're allowed to dig a little further into who those full-time employees actually are. And if you employ 50 or more full-time employees for 4 months or less during the year, and those employees who worked for you in excess of that 50 number were seasonal workers, then you would not be considered a large employer. So that's as generous as the government has gotten with the seasonal exception. So if you have, we could have seasonal businesses that span more than 4 months. The road construction crew, for example, if they work from May through November, that's more than 4 months. So how does this really help them? But this is what they've given us so far. So if your workforce exceeds that magic 50 number for 4 months or less during the year, and the people who are in excess of 50 are seasonal workers, you would not be considered a large employer. So let's go through an example. We have a city that has 49 full-time employees and 0 part-time employees. In June through September, the city hires an additional 300 full-time employees to help control summer tourism and to serve as lifeguards on the beach. This period of June to September is 4 months. So the only time this employer is in excess of 50 or is at 50 or more is during that 4-month period when they're hiring all of these additional seasonal workers. So this would be an example where the seasonal exception would help. And this city would not be considered a large employer, even though during those 4 months they had more than 50 employees. Now let's go to a road construction example. The road construction company has 5 full-time employees for the entire calendar year and 70 full-time employees during a 6-month period of May through October. Now the seasonal exception wouldn't apply, wouldn't help this employer because their period of when they have the giant increase in the number of staff lasts for more than 4 months. But if we actually went through the math, if you think back to the slide that had January, February, March, the first quarter of 2013, where we actually counted full-time employees, we counted part-time hours worked divided by 120, added everything together. If we actually went through this scenario with the road construction company, they may not be considered a large employer after all, even though the seasonal exception won't help them. So if you look at this, we have January through December on this next slide. You can see that in 6 of the months, I've said that they had 5 full-time employees, zero full-time equivalents, 0 part-timers. During 6 of the other months, they had 70 full-time employees because they had so many people on the road construction crew during the months of May through October. The total amount, when you add together all 12 months, is 450. You divide that by 12, you get to 37 and a half. And again, when you get to that last number, you always round down. So this road construction company is treated as having 37 employees during 2013 on average. So they would not be considered a large employer, even though they had a 6-month period where they had many more employees than they did during the rest of the year. So it's important, if you're not sure whether or not you're a large employer, to walk through these kinds of examples and actually do the math to see whether or not you're going to be subject to the mandate. Now, from this point forward, we're going to assume that the employers we talk about have 50 or more full-time employees and they are subject to the mandate. They're called large employers. When you actually look at the requirements and the penalties that would be imposed against the employer, the penalties vary based on whether or not the employer offered absolutely no coverage or whether the employer offered some coverage. So the first example we're going to go through is if the employer offered no coverage. If a large employer offers no coverage to its full-time employees and their dependents, that large employer could be subject to a $2,000 per year penalty per full-time employee on staff. The penalty is triggered once one of the full-time employees goes to the exchange, which George and Pam both talked about, goes to the exchange and is determined to be eligible for a premium tax credit or a cost-sharing subsidy, because those are the 2 financial programs that will be available for individuals who purchase through the exchange. So as soon as one of your full-time employees goes to the exchange and qualifies, the penalty would be triggered. So there could be a situation where you could be a very large employer, offer no coverage, but if nobody from your staff goes to the exchange and qualifies for financial assistance, you would face no penalty. You could have 15 people go to the exchange. If none of them qualified for financial assistance, there would be no penalty. But the penalty is triggered as soon as one of your full-time employees goes to the exchange and qualifies for assistance. When you're doing the calculation, it doesn't matter how many people actually went to the exchange and qualified for financial assistance. You would have to do the multiplication using the amount of full-time employees you have. You are, for whatever reason, we'll go through an example in a minute, you are allowed, when you're doing the calculation, to disregard the first 30 full-time employees that you have. I don't know why the government decided to do this, but I'll show you how it works. So assume that a large employer has 100 full-time employees and does not offer health coverage. If at least one full-time employee goes to the exchange and qualifies for financial assistance, the penalty would be 100 because you have 100 full-time employees minus 30 because of that allowance the government gives us to disregard 30 of your full-time employees when you're actually doing the math. So 100 minus 30 times $2,000 per year, it would be $140,000 per year. Now, it's only important if a full-time employee goes to the exchange. You are never, even though we talked about looking at the hours worked by part-timers when we were a few minutes ago trying to decide whether or not you're a large employer, that's the last time that you have to think about a part-timer. So you are not required to offer health insurance to part-time employees. You're also not going to be penalized if one of your part-time employees goes to the exchange and qualifies for financial assistance. Because after you've made it through the determination that, geez, I am a large employer, you don't have to think about part-time employees at all. So in this next example, we have a large employer. It has 25 full-time employees but has a lot of part-time employees. So when this employer went through the determination of whether or not it was large or small, these part-timers must have worked enough hours that the employer was determined to be large. No health insurance is offered if at least one full-time employee goes to the exchange and qualifies for financial assistance. The penalty would be 25 because that's how many full-time employees you have. It doesn't matter how many part-time you have. So it would be 25 minus 30 because, again, for whatever reason, when we're talking about the penalty associated with offering no coverage, you get to disregard the first 30 full-time employees, times $2,000, so the penalty would be 0. Now, in the next example, let's assume that the large employer has 100 full-time employees and 100 part-time employees and offers no coverage. 5 part-time employees go to the exchange and qualify for assistance. Well, what happens to the employer? Absolutely nothing. There's no penalty applicable to the employer in this case because the people who went to the exchange and qualified for coverage were part-time employees. So that is the penalty applicable if you offer no coverage. The analysis is a little bit different, and the penalty calculation is different if you offer some coverage. If a large employer offers coverage that is considered unaffordable or not of a minimum value to employees, and at least one of the employees goes to the exchange and qualifies for financial assistance, a penalty would be triggered against that large employer. The calculation is a lot different if you offer some coverage than if you offer absolutely no coverage. Here, you would only be penalized based on how many of your full-time employees actually went to the exchange and actually qualified for financial assistance. The government wouldn't look at the total number of full-time employees that you have. It's only important to know how many actually went to the exchange and qualified for assistance in these next examples. And the penalty would be $3,000 per year per full-time employee that actually went to the exchange and qualified for financial assistance. Like the first slide that we talked about during this segment, this one also is loaded in terms of defined terms. It's important if you're offering some coverage and you want to avoid the penalties that your coverage be considered affordable and that it has to provide a minimum value. Now, for coverage to be affordable, there are 4 different ways that you can determine whether it's affordable. And this first one here, this is the technical rule that was actually in the healthcare reform law. Since this has been issued, the government has come up with additional ways that you can determine whether coverage is affordable. They're called safe harbors. So as long as you satisfy one, then the coverage will be deemed affordable. But the technical rule is that coverage is considered unaffordable if the employee's required payment, if the employee's portion of the self-only premium for the employer's lowest cost coverage exceeds 9.5% of the employee's household income. So you're only looking at the employee portion of the self-only premium for the employer's lowest cost plan. If the employee's required contribution for that plan, that lowest cost plan, exceeds 9.5% of his or her household income, it would be considered not to be affordable coverage. So it doesn't matter whether the employee actually chose self-only coverage. You could have an employee who chose family coverage. You would still only look at the employee required contribution to self-only coverage. And if you're a large employer and you offer 3 different benefit packages that employees can choose from, well, one will certainly be more expensive than the others. One will fall in the middle. You only look at the lowest cost option, even if the employee chose the highest cost option. And we'll run through some examples in a few minutes. And then coverage will be deemed not to provide a minimum value if it doesn't cover at least 60% of medical costs. So if you're offering some coverage, again, it's important to know whether or not your coverage is affordable and whether or not it provides minimum value. If it is affordable and it does provide minimum value, you would not be subject to a penalty, no matter what your full-time employees tried to do. If it is unaffordable or doesn't provide minimum value, then you would be subject to a penalty if a full-timer left the employer plan and went to the exchange and qualified for financial assistance. So let's assume that a large employer has 100 full-time employees. The coverage is not of a minimum value. You have 3 full-time employees who decide they want better coverage. They go to the exchange, they qualify for financial assistance. The penalty would be $3,000 per year times 3 full-time employees, because that's how many actually left the employer plan and went to the exchange. So you could conceivably, let's say you're a large employer and you have 60 full-time employees and you offer coverage, but employees are required to pay 100% of the premium. You're still offering coverage, right? So you're in this penalty category. You're not in the I'm a large employer offering no coverage penalty category, which is a lot more damaging for an employer. You're still offering coverage. It's just probably not affordable, because if you as an employee have to pay for the entire premium, let's assume it's not affordable. So if you have 60 full-time employees, you offer coverage that's considered not affordable. If 0 of those full-time employees go to the exchange and qualify for financial assistance, you wouldn't be penalized, because the penalty is only triggered once somebody goes to the exchange, one of your full-timers goes to the exchange and says, hey, exchange, I have coverage at work, but it's too expensive for me. I have to pay the entire premium. Will I qualify for financial assistance here? And they would go through the tests that George talked about. What is your income level? Is your income between 100% and 400% of the federal poverty line? Do you earn too much to be eligible for a financial subsidy? So again, there are certainly circumstances where you'll have a large employer required to offer coverage to full-time employees and dependents. They may do so. It may not be affordable. It may not provide minimum value. But again, the trigger is who's going to the exchange and who's qualifying for financial assistance. Now, if you're an employer who offers some coverage and you're still penalized because maybe the coverage isn't affordable, somebody goes to the exchange, et cetera, the penalty that you would have to pay as that type of employer would never exceed what the penalty calculation would be if you had offered absolutely no coverage. So let's assume in our previous example, we have 100 full-time employees. What would happen if all 100 went to the exchange and said, my coverage doesn't provide a minimum value? The penalty would be 100, because that's how many full-time employees went to the exchange, times $3,000 per year, or $300,000. Now, if you did the penalty calculation using the formula that exists for employers who offer no coverage, and we did that earlier, about maybe 10 slides earlier, the penalty would actually only be $140,000. So you, as the large employer in that case, would only have to pay the lower of the 2 penalties. So in the next example, let's assume that the large employer offers affordable coverage that provides minimum value to full-time employees and their dependents. So here we have an employer offering coverage to the right people. It's affordable. It's of a minimum value. Well, what happens if some of your full-time employees still decide, I want something else. I want to go to the exchange? So they're certainly entitled to decline your coverage. You won't be penalized because somebody declines their coverage. They go to the exchange. What would they qualify for? Would they qualify for financial assistance? And the answer, I believe, is no, because they have this affordable coverage that provides a minimum value available to them at the employer. So the fact that they want to jump ship and go to the exchange won't impact the employer. You would not be penalized for that, because again, the penalty would only apply if the coverage was either unaffordable or didn't provide a minimum value. So let's talk further about affordability, because again, it's important to know whether or not your coverage is affordable. This first bullet point is the bullet point that came from the Act itself that says coverage will be considered affordable if the employee's portion of the self-only premium for the lowest cost option does not exceed 9.5% of the employee's household income. And the problem with this technical rule, we'll call it, is that how do you know what somebody's household income is? Because household income is not just what you pay the person, it's what's earned by the entire household. So that could include the spouse, that could include children. You really have no way to know. So people started raising all the problems associated with this test, and so the government came out with some alternatives, and they call them safe harbors. So if you satisfy either this technical test for affordability or any of the safe harbors, then your coverage would be considered affordable. So let's go through this technical test first. Let's assume that the employer offers only one plan. The self-only premium for that plan is $500 per month. The premium for a family of four is $1,200 per month. And regardless of which option the employee were to elect, they would have to pay 10% of the premium as their employee contribution. So the employee contribution to self-only coverage would be $50 per month or $600 per year. And the employee contribution to family coverage would be $120 per month or $1,440 per year. Now we get to Employee A. Employee A's household income each year is $15,000, and he elects family coverage. So his required contribution to family coverage is $1,440. That is equal to 9.6% of his household income, which means if you were required to look at what this person actually elected, he elected family coverage, this would be considered unaffordable for him. But you're only required to look at the employee required contribution to self-only coverage. And if you were to look at that, you would see that the employee's required contribution to self-only coverage is $600 per year, which is only 4% of his household income, so it's considered affordable. And I just wanted to go through this example to reiterate that it doesn't matter what the employee elects. He could elect family coverage, he could elect the most expensive plan that you offer. You only look at the self-only premium contribution that's required by him for the lowest cost plan. And then here we get to the safe harbors. There are 3 different safe harbors that employers can rely on. One has to do with the W-2, one has to do with monthly wages, and one has to do with the federal poverty line. The W-2 safe harbor states that coverage will be deemed affordable if the employee's contribution to premium for self-only coverage in the employer's lowest cost plan does not exceed 9.5% of the employee's W-2 wages for the calendar year. So this is something where you have a little bit more control. You only have to look at W-2 wages that you provide to the employee. You don't have to worry about household income. But the problem with this, as I see, is that you would apply this safe harbor at the end of the calendar year. So, for example, if we are in 2014, it's important for you to be pretty certain, if you're going to provide coverage, that it's affordable throughout 2014. And if you're looking at 2014 wages, the W-2 for 2014, that won't be ready until the very end of 2014 into 2015. So can you really tell whether coverage that you've been providing all year long has been affordable? And apparently somebody admitted to the government that, geez, well, why don't we just charge them whatever we want for the first 6 months, and then we'll lower the employee contribution to the end, so we'll know that at the end of the entire year, the coverage will be affordable if you look at the entire year. And they said, no, you can't do that. If you're going to rely on this safe harbor, you can't change the employee's required contribution to premium throughout the calendar year. It has to be consistent. So this is a little bit better than the technical rule, but it's still not great. This is a little better yet. This is called the rate of pay safe harbor. So if the employee's required contribution doesn't exceed 9.5% of the monthly pay for that employee, then it would be deemed affordable. Now, the last safe harbor is the only one that does not vary based on what the employee's income is. And so I personally think that this would be the easiest one to comply with. Although if you're actually doing the math, maybe it is the least forgiving for employers. I don't know. It depends on what your required contributions are. But the federal poverty line safe harbor is satisfied if the employee's contribution to coverage for the lowest cost self-only plan that provides minimum value does not exceed 9.5% of the annual federal poverty line for an individual. The 2013 federal poverty line for an individual is $11,170. So doing the math, we know that 9.5% of this amount is $1,061.15. If you divide that by 12 months, you get to $88.43. So as long as you are not charging employees more than $88.43 per month for coverage, then it would be deemed affordable. And again, this may be low. I'm not sure based on what your required contribution to coverage is for your employees, but again, you would look only at the lowest cost plan that you have. And then we get to minimum value because, again, if you're offering some coverage, it's important to know whether or not the coverage is affordable and whether it provides minimum value, because if it's both, you would not be subject to a penalty. Minimum value is achieved if the plan covers at least 60% of medical costs. Now, at this time, there's no easy way to know whether anybody's plan covers 60% of medical costs. What the government said is that they're developing what's called a minimum value calculator. That will be an online tool where you can sit in your office, plug in certain information into this calculator, and it will spit back a number for you telling you whether or not the coverage is of a minimum value. They're also preparing paper checklists that you can use where you would be comparing, I guess I would call it a template plan or a safe harbor plan that the government creates. And if your plan matches closely enough to the safe harbor plan, then it would be of a minimum value. So they're both supposed to be easy tools to use. Whether or not they will be, I don't know. And if those options don't work for you, then you would use actuarial certification. And the idea is for the average employer, the minimum value calculator or the safe harbor worksheets would work for you. It's only if you have a very unique plan where nothing standard that the government provides us to use is going to work for you that you would need to actually contact an actuary. Now, when you're looking at whether or not coverage provides minimum value, we do know that you'll have to input into the minimum value calculator, for example, whether or not there's a deductible. If there is, what's the value of the deductible? What's the size of it? Are there co-payments required? Is co-insurance required? Do you contribute to an HRA? Do you contribute to an HSA? Those are things that will be included in the minimum value calculator. And then I mentioned earlier that there were some new regulations issued late December, early January. And one thing that came out in those new regulations that really shocked me is that the government actually offered a definition of what a dependent is. Because for the mandate, the large employer is required to offer coverage to full-time employees and their dependents. Now, I've been reading this for almost 3 years, and I always assumed that the term dependent meant spouse plus children. Well, apparently it doesn't. It includes only children up to age 26, which means if you're subject to the mandate, even though you may be required to insure full-timers and their dependents, you are not required to provide spousal coverage. So this is something that has been shocking a lot of people, and I wanted to make sure to mention it. Now, I get asked sometimes, these penalties are triggered based on whether or not somebody went to the exchange and qualified for a subsidy. How will the employer really know whether somebody is going to the exchange and qualifying for a subsidy? And the answer is that you'll get a notice from the exchange. If an applicant, meaning a consumer or your employee, goes to the exchange and qualifies for financial assistance, the exchange will notify the employer of this. They'll actually tell the employer the employee's identity, that the employee has gone to the exchange and qualified for some financial assistance, that the employer may be subject to a penalty, and that the employer is permitted to appeal the exchange's determination that the employee is eligible for financial assistance. What I'm waiting to see is whether or not this notice from the exchange will also include some sort of correction period where, for example, maybe somebody has gone to the exchange saying, I wasn't offered coverage and I'm full-time because you didn't realize that they were full-time. You added up their hours incorrectly, or you forgot to count their hours in the first place. Well, if you are given this warning saying, hey, this guy has come to us at the exchange, he's qualifying for financial assistance, do you want to appeal this? There should be a step in there that says, okay, I'll bring that guy back into my plan because I am offering coverage. I realize now that I made a mistake. Let's bring him back in. Now, I say that I hope that there's a provision like that, but maybe for the rest of you, that's only so helpful if you were allowed to bring them back into the plan, because when you really look at these penalties, what's more expensive to you, paying a penalty of $2,000 for somebody who wasn't offered coverage, or actually offering them coverage? Yes. And George may have addressed this, but there are certainly the decision of whether to offer coverage or not shouldn't be based solely on the value of the penalty or the cost of the penalty, because there are tax issues to keep in mind as well. But if you don't already hate me, now this is where you're going to start hating me. In late December, maybe September or October of 2012, I'm sorry, I said late December, I meant late 2012, the IRS issued a notice saying if you are confused at all on whether somebody is a full-time employee and whether you're required to cover them, you can use what are called measurement and stability periods to help you make that determination. And so people were aware that, there was some talk going on about measurement and stability periods. Well, in the regulations issued at the very end of the year, they are still considered proposed regulations. They haven't been finalized yet, but the IRS formally adopted use of these measurement and stability periods. So this is going to come into play for those of you who aren't sure whether somebody is considered full-time. For my law firm, we have probably 200 employees. 190 of us are full-time salaried employees. There's no question we're working more than 40 hours a week, although we really should be looking at whether we're working more than 30 hours a week. But we know that 190 of the 200 people are full-time. There's no question. So we wouldn't use these for that 190 group. Now we have 10 employees that we call part-time casual employees, and their hours vary. So maybe we would have to use these measurement periods and stability periods to determine whether or not we have to cover those 10 people. One way that we are trying to avoid that is just last week our HR department issued a memo saying under no circumstances can any part-time casual employee work more than 25 hours a week, because we want to be sure that those people don't work enough hours, sneak enough extra shifts in to suddenly be considered full-time and eligible for coverage. But anyway, I want to go through these measurement and stability periods because you'll probably eventually hear about them, and I want you to know what's going on. What happens is you will do a look back of the hours worked by your employees. It's called a measurement period. So you will look back, look at the hours actually worked by each individual employee, and determine whether or not they were considered part-time or full-time during that look-back period. Once you've made that determination, if they're considered full-time, they would be offered coverage in the corresponding stability period, which is a future period. If they were determined to be part-time in the measurement period, they would not be offered coverage. Well, you wouldn't be required to offer them coverage in the stability period. You could, but you would not be required to. And that's true even if, let's say, they were part-time during the measurement period and something changed in the stability period and suddenly they went from part-time to full-time. You would not be required to offer them coverage at any time during the stability period, even if their circumstances changed in that stability period and they became full-time. So when you're dealing with measurement and stability periods, there are 3 different categories of employees. You have ongoing employees, which are your current employees. You have new employees who you hire, who you expect to work full-time, and you have new employees that you hire and seasonal employees that you hire where you have no idea, if you look back during an entire measurement period, what their numbers will really look like because they haven't worked for the measurement period yet. So those are called new variable hour and seasonal employees. So you have these 3 groups. How you apply the measurement periods and stability periods vary a little bit based on what group you're talking about, whether it's ongoing, new full-time, or new, you have no idea. So when you're talking about ongoing employees, the measurement period is actually called the standard measurement period, and it will range from 3 to 12 months. As the employer, you can determine how long you want it to be as long as it falls within that range. And you have to apply the measurement period consistently among employee categories. So you can't apply it use a 6-month measurement period for half of your employees, and a 6-month measurement period for the other half, unless there's an employment category that you can satisfy. And so when you look at different categories of employees, you can make a distinction between collectively bargained and non-collectively bargained, salaried versus hourly. Each group of collectively bargained employees covered by a separate CBA, or employees located in different states. So you can make distinctions based on these things, but you can't make a distinction based on any other category. So for example, if you have all salaried employees and you're a non-union employer, you could make no distinctions between measurement periods. Everyone would be subject to the same measurement period. So let's assume that you're looking at your ongoing employees who are your current employees. You've looked at the measurement period. Let's say you went back 12 months, looked at the measurement period, and someone was determined to be full-time during that measurement period because they averaged 30 hours per week or more. They would be locked into their full-time determination during the entire stability period, even if they went down to part-time during that stability period. The stability period would be the greater of 6 consecutive months or the length of the standard measurement period. Because again, as the employer, you're allowed to choose how long the measurement period is going to be. Now, if somebody did not average at least 30 hours of service per week during the measurement period, then the employer is allowed to treat that person as not full-time or part-time. You would treat them as part-time during the entire corresponding stability period. And again, well, the stability period in this case could not be longer than the standard measurement period. But again, I just want to emphasize that somebody's hours worked during the measurement period will dictate whether or not they're offered coverage or required to be offered coverage during the entire stability period. So if something changes for them in the stability period, it doesn't matter. Your requirement to offer coverage doesn't change. Then you have the next group of employees. These are new employees reasonably expected to work full-time. You would not have to put these employees through a measurement and stability period. Instead, you would offer them coverage immediately, subject to any waiting periods that you have in place. And then you have new variable hour and seasonal employees. These are people who you hire and you just can't say for certain whether or not they're going to be full-time or not. This would also include seasonal employees. Even though you are hiring someone maybe full-time during the first 4 or 5 months of employment, if you're not certain that they're going to be full-time during the entire measurement period, then you would treat them as a variable hour or seasonal employee, and you would measure their time throughout the entire measurement period. The measurement period for these folks is called the initial measurement period. So again, even if you know that there will be times during this, let's call it a 12-month initial measurement period, even if you know that there will be times that these employees work full-time hours or greater than full-time hours, if you can't say that they're going to do that during the entire 12-month measurement period, they would fall into this category because it's important to know whether or not they average 30 hours of service during the entire measurement period, not just during certain parts of it. So this could impact seasonal employees, for example. If you hire someone in April because you're opening a golf course, you may be well aware that during April, May, June, July, August, they're going to be working full-time. But during the entire 12-month measurement period, are they really going to be working full-time? So you're allowed to count their hours during that initial measurement period to determine whether or not you're required to offer them coverage during a stability period. Now, when you have one of these new variable hour or seasonal employees start, the initial measurement period has to be between 3 and 12 months. Again, the employer can choose. And the initial measurement period has to start anytime between the employee's actual start date and the first day of the month following their start date. You would measure the new employee's hours of service during this period to determine whether or not the person will be considered full-time or part-time during the corresponding stability period. And the stability period varies based on whether or not this person is found to be full-time or part-time. If they're found to be full-time, well, let's see, I think I skipped a slide. Okay, so the new variable hour and seasonal employees, the stability period varies based on whether or not they're considered full-time or part-time. But again, once you've made that determination in the initial measurement period, they are locked in during the stability period. Now, as the employer, you certainly have the discretion, if you want to, allow them to make a change during the stability period. So for example, if somebody is part-time during the measurement period and they go to full-time during the stability period, you may feel, well, geez, they're full-time now, I should offer them coverage. You're certainly permitted to do it, but you're not required to do it. Now, this is why my law firm sent out a memo last week that said under no circumstances can anybody work who's hourly work more than 25 hours a week, because we want to avoid all of this. The good thing about using these measurement and stability periods is that if you're using them and somebody is part-time in the measurement period and then becomes full-time in the stability period, you won't be penalized for not covering them in the stability period, even though they're currently working full-time hours. And again, if you have employees who are averaging 28 to 32 hours a week and you're not controlling that, you really do have to determine whether or not they're full-time. Now, eventually, you'll have, let's say, a new variable hour employee who's worked for you long enough that they can no longer be considered a new employee. What you would do is you would transition them to the ongoing employee category that we talked about earlier. And there's a process for doing that, but that's getting even a little too far into the weeds for me. But just note that eventually these people would transition to the ongoing employee category. Also, if somebody leaves your employment, let's say during a stability period, they terminate employment and they come back, or they have a leave of absence, what do you do with them when they come back? And what you do with them depends on whether or not you're going to consider them as an ongoing employee or as a new employee. So if somebody comes back after a short enough leave or a short enough termination, if they were considered full-time when they left and they were in a stability period receiving coverage as a full-time employee, you could plug them right back into their stability period and they would get coverage right away. If you're treating somebody as new because their break in service has been long enough, you would force them to go through the measurement and stability periods again. You would not be required to cover them right away. And another reason why this is important is because eventually you're going to get to another measurement period. And if somebody has been terminated during a measurement period or had a long leave of absence during the measurement period, when you actually go and count hours for that person, you're going to have a lot of weeks with big zeros because they haven't been performing hours of service for you. So the general rule is that when you're counting during the measurement period, if somebody has been gone, the general rule is they would get absolutely no credit for the time that they were gone. So that would really impact when you get to the end of that measurement period whether or not they actually are going to be treated as full-time or part-time during the corresponding stability period. But there are some times when you would give the employee credit or you would just exclude those zeros from your calculation. And that is if somebody is on an employment break, that's relevant only to educational organizations, not to other employers. If they're on unpaid FMLA leave or unpaid USERRA leave, or if they're on unpaid leave due to jury duty. So if the reason that your person had a leave of absence was due to one of those four things, you can't give them big zeros during the measurement period. You have to actually either give them credit. You would give them credit based on what kind of hours they worked before they left. So for example, if somebody was working on average 38 hours per week before they left, you would give them credit for 38 hours per week during that period when they were gone. That doesn't impact their compensation. That just means when you're counting hours, you're giving them credit for those hours even though they weren't working. Now, we talked about how nothing would happen if somebody had a change in status during a stability period, meaning they were determined to be, let's say, full-time during the measurement period. They make it to the stability period and they're being treated as full-time and they're receiving coverage, but suddenly they go to part-time. Well, they're going to still continue to get coverage during the entire stability period, regardless of the fact that they're no longer working full-time hours. But what happens if you're still in the initial measurement period? You haven't quite made it to the stability period. You're in the measurement period and somebody's hours drastically change. Well, if you hire somebody, let's say, as a part-time employee, and during that initial measurement period, they're promoted to suddenly full-time status, you wouldn't have to continue to count during the initial measurement period for them. You would be required, actually, to offer them coverage earlier. So if somebody were to have a change in status during the initial measurement period, you would begin to treat that person as a full-time employee. You would be required to do this by the first day of the 4th month following their change in employment status, or by the first day of the 1st month following the end of their initial measurement period, whichever is earlier. There's no way to summarize that into easy lingo, I'm sorry. But let's say that you have an employee, his name is Employee Z, you hire him on March 10th of 2015. His initial measurement period would be May 10th, 2015, which is his start date. It would run for 12 months, so it would go through May 9th of 2016. On his start date, he was a variable hour new employee, meaning the employer really didn't know how many hours is this guy going to average during the course of my entire 12-month measurement period. So the employer is counting hours during this initial measurement period, and what happens is halfway through it, suddenly the employee has a change. He's been promoted. He's promoted into a position where if he had been hired in at that position, the employer would have put him into the new full-time category and not subjected him to the measurement and stability periods. So if that happens, what I'm trying to emphasize is that if you're experiencing a change in status during the measurement period and not the stability period, there would be still some room for movement during the measurement period, because you wouldn't continue to require this person to go through measurement and stability periods. You would offer them coverage earlier. And again, you would offer coverage by the first day of the 4th month following the change in their position, or the first day of the 1st calendar month after the end of the initial measurement period, whichever one is earlier. So let's talk again about why my law firm has a rule that says nobody who's hourly can work more than 25 hours a week. We don't want to deal with this. And I'm not saying that that kind of rule would work for every employer. There are certain employers where it may not just be practical to do that. But what we're really making an effort to do at the law firm is to obviously put people into the full-time category, or make it very obvious that they're part-time, so we don't have to deal with any of these measurement and stability periods. I've also talked to employers who are intending to cover anyone if there's even a question of whether or not they could be considered full-time, because they're so large that it would be an administrative nightmare to actually try and calculate hours during measurement periods and lock people in during stability periods. So they've made a decision that, okay, we'll cover you if there's even a question of whether or not we're required to cover you, because it would just be easier for us, and because of our size, cheaper for us. And I promise we're almost done. There's also new IRS reporting. I've been asked a few times, how is the government really going to know whether or not I'm a large employer, whether or not I'm covering the people I'm required to cover? Well, you're required to let the government know. You have to tattle on yourself. And so there's a new form that you'll be required to complete. The first time you have to send it in will be in early 2015, because it's going to include all of your 2014 data. You're going to be asked, and the IRS is developing a form for you to use when you're doing this. You're going to have to report how many full-time employees you had, the names of those full-time employees, their addresses, their social security numbers, the months in which the employee and any dependents were covered under your plan, the length of any waiting periods you have, whether or not your coverage was affordable, whether it provided minimum value. So you're going to have to report all this to the IRS. And you also have to send your employees a written statement that summarizes what you reported to the IRS. And I don't know the purpose for that, except I'm thinking that the IRS may want to have some way to warn employees, if you try to come to the exchange and lie to us about whether or not you have coverage available to you, even if you snuck it in and you did get subsidized coverage from the exchange, we're going to find out eventually. And if they find out eventually, let's say you received a premium assistance tax credit, you would have to eventually pay the government back if you weren't entitled to that. So, okay, so we are going to now take a break, and everyone can wake up and have some coffee and hopefully some snacks. And again, we understand that this is a very muddy area, but we want you to be able to at least have a working knowledge of how it's going to be.